akong i-unbox ngayon. Uh, Pulse Oximeter. This is from Shopee. Disinfect ko na siya. Sige, open ko na. Ayan guys. Na-open ko na siya. Ito yun, no? Aeolon. May kasama pa siyang nalagyan, no? May card pa. Thank you for purchasing. Ayan, sa loob ng box niya ito. Kanyang wire. USB Type-C cable. Ang unit. Ang liit niya. Ang unit. Manual. Manual kung paano gamitin. Tsaka yung sa ano, kakabit mo siya sa kanyang lalagyan. Yun, no? Pulse oximeter front and left panel. Percent of SP02. Pulse rate display. Power indicator or battery indicator. And pulse amplitude indicator. Pulse oximetry. Purpose, uses, and how to take a reading. Pulse oximetry is a non-invasive test that measures the oxygen saturation level of your blood. It can rapidly detect even small changes in oxygen levels. These levels show how efficiently blood is carrying oxygen to the extremities farthest from your heart, including your arms and legs. The pulse oximeter is a small, clip-like device. It attaches to a body part, most commonly to a finger. Medical professionals often use them in critical care settings like emergency rooms or hospitals. Some doctors, such as pulmonologists, may use them in office settings. You can even use one at home. Purpose and uses. The purpose of pulse oximetry is to see if your blood is well oxygenated. Medical professionals may use pulse oximeters to monitor the health of people with conditions that affect blood oxygen levels, especially while they are in the hospital. This can include chronic obstructive pulmonary disease or COPD, asthma, pneumonia, lung cancer, anemia, heart attack or heart failure, congenital heart disease. How to take a reading. Pulse oximetry may be useful in both inpatient and outpatient settings. In some cases, your doctor may recommend that you have a pulse oximeter for home use. To take a reading with a pulse oximeter, you will 1. Remove any jewelry or fingernail polish on your finger if measuring from this location. Make sure your hand is warm, relaxed, and below heart level if attaching the device here. 3. Place the device on your finger, earlobe, or toe. 4. Keep the device on for as long as needed to monitor your pulse and oxygen saturation. 5. Remove the device once the test is over. In pulse oximetry, small beams of light pass through the blood in your finger, measuring the amount of oxygen. According to the British Lung Foundation, pulse oximeters do this by measuring changes in light's absorption in oxygenated or deoxygenated blood. This is a painless process. The pulse oximeter will be able to tell you your oxygen saturation levels along with heart rate. Pulse oximetry readings. Pulse oximeter tests are an estimation of blood oxygen levels, but they're typically precise. This is especially true when using high-quality equipment found in most medical offices or hospital settings. With this equipment, medical professionals can carry out the test accurately. The Food and Drug Administration, or FDA, requires that prescription oximeters must provide results within an accuracy range of 4 to 6%. The American Thoracic Society says that typically more than 89% of your blood should be carrying oxygen. This is the oxygen saturation level needed to keep your cells healthy. Having an oxygen saturation temporarily below this level may not cause damage, but repeated or consistent instances of lowered oxygen saturation levels may be damaging. An oxygen saturation level of 95% is considered typical for most healthy people. A level of 92% or lower can indicate potential hypoxemia, which is a seriously low level of oxygen in the blood. Various factors can affect readings, including a person's skin tone. How your blood oxygen level is measured. 1 is arterial blood gas. An arterial blood gas or ABG test is a blood test. It measures your blood's oxygen level. It also can detect the level of other gases in your blood, as well as the pH or acid or base level. An ABG is very accurate, but it's invasive. Second is pulse oximeter. A pulse oximeter or pulse ox is a non-invasive device that estimates the amount of oxygen in your blood. It does so by sending infrared light into a capillaries in your finger, toe, or earlobe. Then it measures how much light is reflected off the gases. A reading indicates what percentage of your blood is saturated, known as the SpO2 level. This test has a 2% error window. That means the reading may be as much as 2% higher or lower than your actual blood oxygen level. This test may be slightly less accurate, but it's very easy for doctors to perform, so doctors rely on it for fast readings. If below normal, a below normal blood oxygen level is called hypoxemia. Hypoxemia is often cause for concern. The lower the oxygen level, the more severe the hypoxemia. This can lead to complications in body tissue and organs. What happens if your oxygen level is too low? When your blood oxygen level goes outside the typical range, you may begin experiencing symptoms like shortness of breath, chest pain, confusion, headache, and rapid heartbeat. How to use pulse oximeter. Pinch one end of your pulse oximeter so the other end opens slightly. Hold your other hand so your palm faces toward you. Then clip your pulse oximeter onto your index, pointer, middle, or ring finger with the display facing toward you. Make sure your finger is clean and you aren't wearing nail polish or artificial, such as gel or acrylic nails. Product charging. Hold the product with the both fingers of the left hand. 2. Pick up the lid with your right thumb. 3. Plug in the charging data cable. 4. After charging, unplug the data cable and cover it. Sa mga nagtatanong na magkano to, sa Shopee, kanyang price is 489 pesos. With the original price is 999 pesos. Okay guys, na-explain ko na at na-unbox ko na ang pulse oximeter. Kung nagustuhan niyo po ang video to, just subscribe, like, and share para updated kayo sa next video namin. Salamat!